the one thing that I think, well, there's so many implications of this that are game changing, but the one thing that I was frustrated with when I was trying to figure out whether or not I would get vaccinated. I did it basically because my wife was going to do it, and I didn't want her to turn into a zombie and me have to like put her down. That would be an awful way to end our marriage. So I figured we could shuffle off into zombie heaven together. But when I tried to research my own particular health situation, all I found was propaganda.
Yeah,
even in the health science journals, and one thing that's so shocking to me is how the CDC in particular, but all of these public health organizations, it's all propaganda. Why do you think that is?
Oof, that's a good question. I don't know. I think that the best interpretation, I think, is that they think it's easier. It's just easier to tell everybody to go get the shot. If you die of a heart attack 10 years earlier than you would have without it, that's very hard to prove, and they're never going to be blamed for that. But COVID cases, which is ridiculous to even be counting cases at this point, but it's another subject, they'll be blamed for COVID cases. So they think that they just tell everyone to get the vaccine. That's better for them. I mean, there's also just the question of profit. I mean, pharma is making a huge profit off this. And I think that's a likely explanation for part of what's going on.
Yeah, the intertwined nature. So I watched the Rogan Malone interview. Yeah. We all sort of snuck off into a dark corner and watched this.
Before, didn't it get taken down or something? Yeah.
Is it off Spotify now?
I think it's off, yeah.
It's amazing to me. So naturally, everybody's now going to watch it more.
Yeah.
But the one thing that I learned from hearing that interview, and I knew this, but like it's amazing how intertwined the research arm of the government and the funding of government research grants is with pharmaceutical companies. And it's not at all clear where the line is between public and private when it comes to a lot of healthcare products that come out of pharmaceutical companies, but particularly this vaccine.
Yeah.
So I think there's that the profit motive is quite interesting, because if I was a private company and I could get the government to mandate that everybody has to get the shot and then get boosted, like that's a good business model.
Yeah.
But it's empowered by the fact that the monopoly power of the state. I mean, sure, private companies want to make money, but only the government can force everybody to take this
right.
vaccine. That seems like a pretty toxic mix.